Did you know that 1 in 3 women over 60 will suffer a hip fracture in their lifetime? And here is what terrifies me as a doctor. 20% of those women will die within just 1 year of that fracture. But what if I told you that most of these fractures are completely preventable? Stay with me, because the next 10 minutes could literally save your life. Hi, I'm Dr. Sarah Mitchell, and in my last video, we talked about the silent warning signs of bone loss. So many of you commented sharing your stories, and I was honestly heartbroken by how many of you have already experienced fractures. Today, we need to talk about the one fracture that changes everything, the hip fracture. I'm not sharing this to scare you. I'm sharing this because knowledge is power, and understanding your risk is the first step to protecting yourself. So let's dive into what every woman over 60 absolutely must know about hip fractures. First, let's talk about what a hip fracture actually is. Your hip joint is where your thigh bone, called the femur, connects to your pelvis. A hip fracture is a break in the upper part of this femur bone. Now, you might think it's just a broken bone. They can fix that, right? Hear us, what makes hip fractures so different from other broken bones? When you break your wrist or your ankle, yes, it's painful, and yes, it requires treatment, but you can usually recover at home with some modifications. A hip fracture, it almost always requires surgery, and that surgery comes with serious risks, especially for women our age. We're talking about anesthesia, complications, blood clots, infections, and pneumonia. And even with successful surgery, many women never return to their previous level of independence. In fact, only 50% of women who break a hip will ever walk independently again. Let that sink in for a moment. Half will need a walker, a cane, or a wheelchair for the rest of their lives. So why is a hip fracture so dangerous? It's really a domino effect. First, the surgery itself is major. We're talking about inserting pins, plates, or even replacing part of your hip joint. Second, you're immobilized for weeks, and when seniors stay in bed for extended periods, complications multiply. Pneumonia can develop from shallow breathing. Blood clots can form from lack of movement. Bed sores can appear. Muscles atrophy incredibly fast. Third, and this is what concerns me most, the psychological impact. Many women become terrified of falling again. They stop moving, stop going out, and become isolated. And that isolation leads to depression, further muscle loss, and even cognitive decline. I had a patient last year, Barbara. She was 67, vibrant, active, volunteering at her church 3 times a week. She fractured her hip just reaching for something in her closet, a simple fall. After surgery, she developed pneumonia in the hospital. She spent 2 months in rehabilitation. By the time she came home, her confidence was shattered. She stopped driving, stopped volunteering, and barely left her house. That's the real danger of hip fractures. They don't just break bones, they break lives. Now let's talk about risk factors, because some women are at much higher risk than others. You are at high risk if Number 1, you're over 70 years old. Your risk doubles every 5 years after 60. Number 2, you've already had 1 fracture. This is huge. If you've broken any bone after age 50, your hip fracture risk is 86% higher. Number 3, you have osteoporosis or osteopenia. If your last bone density scan showed low bone mass, you're in the danger zone. Number 4, you're thin or small-framed. Women under 127 pounds have a significantly higher risk because there's less cushioning around the hip. Number 5, you take certain medications, steroids. Some diabetes medications and even certain antidepressants can increase fall risk and weaken bones. Number 6, you have balance problems. If you've had even 1 fall in the past year, your risk is 3 times higher. And number 7, you live alone. Not because living alone causes fractures, but because if you fall, delayed help increases complications. Now pause for a second and count how many of these apply to you. If it's 3 or more, we need to take serious prevention action, starting today. Okay, here's the good news I promised. Hip fractures are not inevitable. Let me share the exact prevention strategies I give to all my high-risk patients. Strategy number 1, strengthen your bones from the inside. You need 3 things: calcium, vitamin D, and protein. Here's your daily target: 1,200 milligrams of calcium, 2,000 IU of vitamin D3. Yes, that's higher than the old recommendations, and at least 80 grams of protein. Why protein? Because even if your bones are strong, weak muscles can't protect them during a fall. Best sources are things like Greek yogurt, cheese, sardines with bones, fortified plant milk, eggs, and lean meats. Strategy number 2, do the right exercise. And I'm not just talking about walking, although walking is great for hip fracture prevention. You need weight-bearing and balance exercises. 3 times a week, you should be doing squat, sit to stand exercises to build hip and thigh muscles, side leg lifts to strengthen the muscles that protect your hip, and single leg stands to improve your balance. Even just 15 minutes 3 times a week can reduce your fracture risk by up to 40%. Strategy number 3, fall proof. Your home. This is non-negotiable. Most hip fractures happen right at home. Walk through your house today and fix these things. Remove all throw rugs. I don't care how pretty they are. Install grab bars in the bathroom, not just in the shower but by the toilet too. Improve lighting, especially in hallways and on stairs. Remove clutter from walking paths and wear non-slip shoes even when you're just inside your house. I tell my patients, your home should be a safe zone, not an obstacle course. Strategy number 4, protect your hips. If you're at high risk, consider hip protectors. These are special undergarments with padding over your hip bones. Studies show they can reduce hip fracture risk by 60% in high-risk women. Yes, they're a bit bulky. Yes, they take some getting used to, but they work. Strategy number 5, get your vision and hearing checked. This surprises people, but poor vision and hearing significantly increase fall risk. If you're squinting to see or missing auditory cues about your environment, you're more likely to trip or lose your balance. Get checked annually. Strategy number 6, review your medications. Some medications can cause dizziness, confusion, or weakness. Make an appointment with your doctor specifically to review every medication and supplement you're taking. Ask them, could any of these increase my fall risk? Sometimes a simple dosage adjustment or a change in timing can make all the difference. Strategy number 7, consider bone strengthening medication. If you have osteoporosis, medication isn't optional, it's essential. Yes, there are side effects to discuss, but the risk of a fracture without treatment is far greater than the risk from medication side effects. Have an honest conversation with your doctor about bisphosphonates or other bone medications. Now, I want to be honest with you about what happens if prevention fails, because understanding the reality of hip fracture recovery is a powerful motivator. The statistics are sobering. Within 1 year of a hip fracture, 20% of patients will die from complications, 50% will never walk independently again, 25% will require long-term nursing home care, and 80% will lose the ability to do at least one daily activity on their own. The recovery timeline is long. Surgery usually happens within 24-48 hours. You'll be in the hospital for 5-7 days if there are no complications. Then you might go to acute rehabilitation for 2-3 weeks if you're strong enough. Otherwise, it's a nursing facility. Physical therapy will be a minimum of 3-6 months. Full recovery. If it happens, it takes 6-12 months, and remember, only half of women achieve a full recovery and the cost. The average cost of a hip fracture, including surgery, rehabilitation. But what breaks my heart most is the loss of independence, the fear, the isolation. Women tell me things like, I don't feel like myself anymore, I'm a burden to my family, I'm afraid to move. That's why prevention isn't just about avoiding pain or medical bills. It's about protecting your independence, your confidence, and your quality of life. Every single strategy I shared today. Think of it as an investment in your future freedom. Okay, so here's what I want you to do right now. Action step number 1, go back and count your risk factors. Be honest with yourself. Action step number 2, if you have 3 or more risk factors, call your doctor tomorrow. Say, I need a bone density scan and a fall risk assessment. Action step number 3, pick one prevention strategy from today's video and implement it this week. Just one. Maybe it's removing those throw rugs. Maybe it's adding a calcium supplement. Maybe it's starting those balance exercises. Small actions add up to massive protection. And action step number 4. In my next video, I'm going to show you the exact 5-minute exercise routine I teach to prevent falls and build hip strength. No equipment, no gym, just you in your living room. Make sure you subscribe so you don't miss it. And please share this video with your friends. 1 in 3 means someone you love. We'll face this. Let's protect each other. Drop a comment below. What's your biggest fear about falling? I'm here to help. Remember, you are stronger than you think, and it's never too late to protect yourself. I'll see you in the next video.